snowed out, so I'm glad you were able to make it. Senator Aguilar.
Good evening, everybody. I'm Pat Stedman. I'm the state senator for District 31, which is Irene's next door neighbor.
Yes. And actually, we're going to be knocking up against each other right here at about Glencoe. On the other side of I-25 will be Pat's district, and I'll be on this side. And as some of you may know, the districts were redrawn. Right now, the area we're in is still in Senator Joyce Foster's district, but at the end of this term, she'll be retiring, and it will, parts of it will be split between Pat and I. And so we're very much on the cusp of our two districts right now. And we have a guest speaker coming, so I wanted to have Pat and our other guest speaker update you some on the efforts they're doing in criminal justice, try and work toward helping people get back into society and stay out of prison. But since she's not quite here yet, Christy, I thought I would actually use this as a few minutes to let you guys ask some questions if you wanted before we got started, because it seems like you always run out of time. Jane, is that right?
Nancy.
Nancy, I'm sorry, Reed?
The hammer.
Is there a Jane Reed in the room? That's what I was going to go. Hi, Nancy.
Hi, I'm a retired child welfare worker from Denver County. So even though I'm retired, I still get riled up about some things.
Yeah.
I would like you to explain this pregnancy and evidence of substance abuse, because I've never known any women that I ran into through my 32 years of child welfare that got arrested for being pregnant and testing positive for drugs. What happens is, obviously, sometimes child welfare gets involved. And I'll say my one nasty thing about it.
I like nasty, go for it.
Well, it gets reported, depending on whether you were born, whether the baby was born in a public or a private hospital. Private hospitals don't report it. Things like that don't happen. And it gets reported whether you're on Medicaid or not. If you're on Medicaid, it's more likely to be reported, da-da-da-da-da. Class warfare, I guess we're calling it. So what happens, as you may know, is that when child welfare gets involved, we have to do an assessment, obviously, of the mother and the whole family. And frequently this happens after the mother leaves the hospital, of course. Sometimes babies have to stay in the hospital because they're quite ill. So I'm wondering what kind of child welfare, child protection stuff can be written into this, because it's not against the law to have a baby who's drug offending, as it is not against the law to have a baby who's alcohol offending. No, that's a legal substance. So there's a lot of issues around this that I could see mothers and fathers saying, well, this isn't against the law. So get out of my house, and you don't need to be here. Because it gets sort of, as you know, these initial investigations anyway.
Yeah,
Be sort of hostile and dangerous.
Yeah.
So, thank goodness I don't work anymore, but I'm concerned about that.
Well, because of your level of concern, I'm sort of sad you're not working anymore. It sounds like you were very invested in this. Thank you for your service, by the way. So she's asking about House Bill 1100, which actually was started in the House of Representatives by Representative Ken Summers, and then came over to the Senate, and I was the Senate sponsor. And the way this bill came about actually was through the Colorado Methamphetamine Task Force. They have a sub task force, or I can't remember what, committee on helping to prevent substance abuse or the exposure of neonates to substance abuse and drugs when at all possible, because as many of you may know, children, as you mentioned, affected with alcohol at birth can have long-term effects, and children exposed to other drugs as well can have long-term effects. In Colorado, our Colorado Medicaid program, stereotyping I know, but it does pay for substance abuse treatment for pregnant mothers. And even though it's estimated that a certain number, like 2,000 pregnant moms in 2010 might have been using illicit substances, they only had a referral of 250 people into the treatment program, and of those 250, only 6% were referred by providers. So one of the goals of the task force is to get providers testing and screening women for substance abuse early in their pregnancy. If you've been involved in treatment of substance abuse at all, there are times when people are sort of more amenable to treatment and more willing to enter into treatment, and pregnancy is one of those times. And so the real goal with this, I would agree with you that it's uncommon for providers to find a screening test and refer somebody to criminal justice. But when you ask people why they don't test, sometimes it's because they don't want to find out. Or if you ask women why they don't tell, it's because they don't want to be found out. And so the goal with this really is to encourage providers to ask their pregnant women if they're using substances, and all pregnant women, not just the people they stereotype as using substances. And the hope is that someday, when we do that prenatal or perinatal screening, that we might also screen for substances to increase our detection and increase our treatment. So that's where the goal is. It's really at the moment of detecting the pregnancy, so it's with a pregnancy test or when you come in for prenatal screening. And I would agree with you, it's unlikely anyone would have been referred anyway, and I think the goal is really to try and decrease barriers to asking women about substance abuse and to screening them for substance abuse.
Okay. Is there any treatment for the baby after the baby is born that's like, besides Medicaid, that's an extra something?
You know, I know the Medicaid-related program I know covers the mother through her pregnancy and also for the first couple of months afterwards, providing support and helping her to be a good parent. But obviously, all along this way, if there's any concern about her other children or the newborn children, then unfortunately it still goes to the Human Services Department for investigation and monitoring. So that would just be part of the regular process.
Okay, thank you.
Pete?
The one about maternal oral health, I've had experience with two children who were from poor families, and they both had abscess teeth, and they missed school because of that. And I think it's one of the most common reasons for poor kids to miss school. But is there evidence that, and they didn't get the care because they couldn't afford it, the preventive care. Will this bill change that? Will the kids be able to get preventive care so they don't get the abscesses?
So children who are on Medicaid and Medicaids already have a dental benefit. There's some research that suggests that if a mother takes care of her own teeth, she'll teach her children how to take care of theirs. And so the goal of this bill really is to be preventative by having more mothers invested in healthy teeth and teaching their babies and preventing problems in the long run. Senator Stedman can talk to you more about this bill because I know right now it's really tied up because it would cost a lot of money up front. And I'll let Senator Stedman explain to you how our budget works, but it's really hard to get money for something we know will save money in 2 or 3 years right now this year. Do you want to address that?
Yeah, and Senator Aguilar is passing this off to me because I serve on the Joint Budget Committee, and I chair the Senate Appropriations Committee. And so anything that concerns state spending or hits the state budget are things that everybody turns to me for.
It's a nice term.
This bill has been proposed by Senator Nicholson, and she's done a lot of work to try to build the case for this. The issue is if we can do more for maternal oral health during pregnancy, there is less likelihood that the mother is going to transmit certain gum diseases or other things to her newborn baby. Because then we're having situations today where there's some kids on Medicaid who are getting their baby teeth pulled or capped, and it's really serious dental work because of things that are preventable and also are transmitted from the mom. Some mothers are chewing food, they can't afford baby food, and so they're chewing adult food and then giving it to the baby. And they're transmitting all kinds of bacteria and gum disease when they do this. And so we're spending a lot of money on dental care for little kids that we think is preventable. The problem is doing more during pregnancy and early in the child's life, the costs that we will incur up front to work with those children's moms are costs that will save when that child is 3 or 4 or 5 or 6 years old in dental care that they'll need at that point. And our budget process is an annual budget process, and I can't fund the provision of services to the mom in year 1 based upon savings that we expect to realize in year 5 or 6. It costs money up front, and we know we'll save money down the line, but right now we need to find about $3 million this year to get this program started. I think it's a great idea, and it's going to be one of many challenges this year as we try to balance the budget.
Will it apply to undocumented mothers and children?
Pregnant mothers do get medicated.
Let's see, for undocumented are not eligible for the Medicaid program except for emergency labor and delivery services. And I do believe there is prenatal care that goes along with the emergency labor and delivery. But exactly where this program fits in there, I'm not certain, because some of it is during pregnancy when we are providing services, and then some would be after pregnancy when they're no longer eligible. And so that's a good question I don't know the exact answer to. And this may be an example of where that person's immigration status kind of makes them eligible for something to get half a benefit, and then they sort of fall off a cliff because they pass that point in time of eligibility.
I'm going to go ahead and we'll do more questions in a minute, but I want to go ahead